I have realized is that people don't know very basic things about their own body. So today the lecture will be like 5th grade biology and anatomy. Not exactly, of course, we will go into some concepts at the end that are a little bit more complex than that. But I have realized that even just the direction, the notions of how your joints can bend, what the body is made of, where the things are, is a bit confusing to people. I say people, lateral flexion, and they look at me like I'm talking a language that they don't understand, and I have observed it. And I decided that the next lecture will be covering the very basic things. So we will start first with just zooming in and zooming out. So we have the human body, which is will be the end of our zooming out system, into systems. Because it can be zoomed even further out, the family, the site, etc., etc. We're not going to go into this today. But within our body, what is the minimal thing that you can reduce it to? If we go zooming all the way down.
Cells.
Not the cells will be already the third step. The atoms, then the protons and stuff. Then cells form the groups of cells, and your body really, if you go into the microscopic level in each cell of your body, it will be all the same thing. And it is true to anything that you encounter actually around you. But as we're zooming out, the way that the cells behave when they're already grouped out of these different protons and atoms, etc., they behave in a certain way and they form groups that are behaving in one way or another when we're talking especially about the human body. So the cells will create organs. A muscle is an organ, and it is constructed out of cells that all behave very similarly. Then within this organ there are different parts to it. There is the muscle body and then there is the tendon. The only difference between the muscle body and the tendon is not the quality of cells themselves. It's a nice rhyme. Not the quality of cells themselves, but the way that they are organized in the matrix. And the same is true for other organs, heart, liver, lungs, whatever it is. There's a specific way that the cells behave, and then they clump into these groups, and then within the system of human body, they have a certain function. Then, what is next? After the organ, you see how it's needed in this lecture? There are systems of organs. There is a respiratory system, nervous system, musculoskeletal system, urinary tract, everything that detoxifies the body, which is the liver, the urine, the digestive system. And then the systems together form human body. The system that is most relevant for movement will be, of course, the musculoskeletal system, which we will be concentrating mostly on today. But thinking of movement, just reducing it to muscles and the bones is also not a great approach. But the discussion should start somewhere. So this is a good way to begin learning about yourself, about the body, and about the way that you can then relate to moving it in space. So you have these posters here, for example, which have all these names that they use in Latin, the names of the bones, the names of the muscles. We're not going to do it today. If you want, you can, of course, find this information anywhere online. There are atlases for anatomy, etc. If you're not a medical doctor or a physiotherapist, I don't think it's necessary. The major groups, to know, maybe it's okay. If you want to go there, I always encourage people studying. But maybe in relationship to other things, it might be a waste of time, just memorizing all these muscles. Because for me, the better way to think about the body is to think in the more general terms. But of course, the understanding of, what the things consist of is also pretty good. So, what are the movable parts in the body? Joints. Joints are the movable parts in the body. Today, the main thing that we will do, I will talk about some other things, but then we'll just go through the entire body and we will denominate the terminology of how your joints move. So when in the class I tell you, pronate your left forearm, you will know what I'm talking about. Okay? So it is important to have this terminology because we need to communicate these things. And when you're giving a feedback to your partner, if you know the name of the muscle and you tell them, no, your deltoid is not firing there, and they don't, it's like you're talking Chinese and they're talking Russian to you. Like the dialogue is not happening, you know. So, the joints. Basically, the definition of a joint, it will be when two bony surfaces come together. And there is a certain amount of movement that is possible. And there are different classifications of the joints. So, and different types of classifications. So, for example, one of them is the structural classification. There will be 3 options. The fibrous joints. Mainly here, this model doesn't have such a great, it's not a great model, but it has certain attempt to show us that skull is not, many people have no idea about anatomy, they think it's just a box. In reality, even the top of the skull, which is the hardest place in human body, it consists of bones that are put together and they are connected by these fibrous joints. Fibrous because they are connected by fiber and they are not really movable, these joints. There is not much movement in the skull, but there is still certain amount of movement in it, which people often neglect. There are different types of treatment like sacral craniosacral therapy and stuff like that. There are certain rhythms of the bones that need to be respected, etc. So when you are treating a certain issue in the body, it's good to think about all the parts that the body consists of. So maybe in a rare case, when you have headaches or migraines or whatever, the cause can be because there is not enough movement in the joints of your skull, for example. Okay, the next classification, cartilaginous. Cartilaginous, is it correct? Who's English speaking? Cartilaginous? Cartilaginous.
Ah, that sounds so better.
Cartilaginous?
The first one.
Cartilaginous.
Yeah.
Yes? Yeah. Okay, cartilaginous is the cartilaginous joints that are connected by the cartilage, and then there are synovial joints which have what is called the synovial liquid. They are little sacs that contain liquid inside, and if they're broken, for example, the bursitis that you may have is the leakage of one of these bags with synovial liquid. Another form of classification is functional. So there is the synarthroses, they're called, which are not mobile. So it will be the same as the fibrous. There are amphiarthroses, the joints that are slightly movable. For example, the joints in the wrist. Okay, there is movement in them, but it's more of a global movement of the whole thing. But in each of the joint of the hands, which also if you want to be really nerdy, you will learn like the name of all of these joints because each of the different joint surfaces has a specific name. Do you need to know that? Not really. But if you want to, studying is always good. And the third functional classification is the arthroses. Joints that are fully movable. The shoulder and the hip, for example, will be such joints. Another way of classifying the joint is by the number of articulating surfaces. And it will be uniaxial, that has just one axis of motion. Biaxial, that has 2 axes of motion. And multiaxial, that has 3 and 3, which is Which brings us to the next thing that is important to know. So, when we're talking about the space in which we find ourselves and in which movement happens, it is usually talked about in the terms of different planes. Okay, so those of you who are coming for a while, and those of you who did the spinal work with us, we're doing these different waves in different planes: the sagittal plane, the frontal, and the transverse. Okay, so the sagittal plane will be, if I cut myself, or let's better show it in our assistant here. Okay, if I cut him by this line, okay, so looking from the side, this is the sagittal plane. Okay, then there is a frontal plane, or sometimes it's also called coronal plane, mostly in medical text. We should be cutting our body here by this line. Okay, so this looking from the front is the coronal plane. Usually all the assessments of the posture, etc., they are done in this plane. Then the next one will be transverse, which is parallel to the floor. So it will be cutting our friend in the middle of the torso. So it's good to know these things, and this is a way to relate to the space and to communicate with each other. It's like you need to do this movement in the sagittal plane more than in the transverse. Again, if I give an example of something, this communication comes in handy. However, this way of describing space is a way to put three-dimensional space on two-dimensional paper, really. It is also used in robotics. In robotics, they use actually what is called 6 degrees of freedom. They're also called degrees of freedom. I will come back to this in a second. So 6 degrees of freedom are relating to these 3 planes: sagittal, transfer, and frontal, which will be movement in space. So moving forward and back, that's one. Moving from left to right, another, in the coronal plane, going up and down. And then there is movement around the axis in these planes. So it will be rolled forward, it will be all kind of tilts to the side, and it will be rolled around yourself, okay, around the central axis of the body. Okay, so they have specific names that they use in robotic: the yaw, pitch, and roll. I have the word yaw, when I was reading about this and about robotics, I have never heard it before in my life. The yaw. But we use it. That's like the official terminology. Yaw, pitch, and roll. The other ones are surge, heave, and sway. Okay, which is surge is forward, backward, heave is up and down, sway is left and right. Okay, which is a little bit easier. But in robotics, or in any machines or robots, the problem of degrees of freedom, which means if there is more than 1 degree of freedom, which means movement only in one of these 3 planes, either around the axis or displacing yourself, creates huge problem of control of robot. That's why it's really actually not moving as fast as they think it is. They are all, yeah, we're gonna make a robot that is exactly, but there is huge problem with how do you control it. In human body, it is controlled. What do you think is the answer to this? How do we control such redundant degrees of freedom? It's what Nikolai Bernstein calls the degrees of freedom problem, or motor equivalence, which is also a fancy way to put it. Anyone?
Brain.
The nervous system. Nervous system, but what exactly it does? Nervous system, of course, but it's too general.
Brain.
No, like how do you control movement by pain? What is it?
Don't go there. No.
Sometimes it needs to go there, sometimes it wants you to pay attention. By sensory control, the problem of controlling the excessive, enormous degrees of freedom that exist in human body is sensory control. This is important to understand. The more you develop the sensory control, the better control over all this joint system you will have. And talking about the joint systems, we talk about these planes, about the different axes. In the human body, there is always more than one in terms of, even if I move just this, and I'm isolating the joint as much as I can, it's never very clearly movement in just one plane. There are always certain combinations. This is why I also like to think about the space I move in, not in terms of these planes, but more in terms of the sphere around me. So the way we think about things and the way we describe them very often limits us to this description. This is, for example, why I find word biomechanics very problematic, because it makes you think about yourself as if you were a machine, which is not the case. The body is not a machine. And if you perceive it as a machine and you think that there are like changeable parts, something can break and then you can do another thing, or you think about it in this way of moving that is very linear, it will affect the way you move. So, it's good that we have the field of biomechanics, it's good that we have the field of anatomy, which describes all these different structures separately. But it's always important to understand that the map is not the territory. Okay? This is just the models, the way of thinking, of studying the body, of discovering something about yourself. But we don't want to be bound and limited to that. It's important to say. So we have these planes of motion that we will describe motion with if we talk to each other. But when you move, try to think it in a more accessible way, that everything around you is the space which you can cover with your body. Let's put it this way. Because it's never, which plane is this exactly movement? Which plane I'm moving in? It's the combination of things. Okay, and if I will try, there are many people over the history that were trying to create a certain language of noting the movement down. So to describe this, it would take them like 5 pages, of different categories, and this is the way in the forces, and the way that the joints relate to each other, and the way that they relate to gravity, and the way they relate to space, etc. So these are important things to understand. There is another classification of joints that I wanted to mention before we continue, which is by type of movement that they produce, which will be the hinge joint that moves only in one plane. For example, the elbow is a hinge joint and the knee is a hinge joint. Okay? It has only 1 degree of freedom, meaning it moves in only one plane. One plane, remember everything that I mentioned before, nominally in the field of biomechanics, it is only one plane. Okay? About certain degree of rotation that the tibia and fibula might have, we're not going to be talking right now. Then there are pivot joints that are always also have only 1 degree of freedom, but they move in a rotational fashion around an axis. For example, the joint that we call atlas axis between the first and the second vertebra is the pivotal joint. Ball and socket joints that have multiple degrees of freedom, nominally 3, but which will be the shoulder and the hip, which are the most mobile joints in the body, which also causes them to be injured more often than others. The next category is saddle joint, the joint that moves in 2 planes. Saddle, like the saddle on the horse, I'm pronouncing it correctly, saddle. So there will be 2 planes of motion. For example, thumb is one side joint, the one that connects the thumb to the wrist. So it will have 2 planes of motion. Then there is a condylom joint, the joint that also has 2 planes, but there is no rotation in the joint. For example, the wrist. Condyloid, it talks to a specific surface on the bone that is at the joint, creates the joint surface. And then there is a gliding joint, movement of which is gliding. Okay, carpals, for example, are such joint. So now we will go through the whole body, as I said, and we will just create this terminology of how things move, so you have an idea of how to describe it, even to yourself, just to think about these terms or help your partner, because sometimes it's so there are always paradoxes. No, everything I said before is true. But also it's true that we need to describe things and we need to create certain terminologies and certain categories in order to understand them better. Remembering that map is not a territory, we can use these different layers of maps. Like for example, where we can talk about the human body on the level of musculoskeletal system. We also can talk about human body on the level of neurology. We can talk about human body on the level of philosophy. You know, there are many ways of relating to things. But knowing something so basic as we are talking about, I think is very important. So when you will have this terminology, maybe certain things that you have trouble with in the class or whatever you're practicing them will make a little bit more sense to you. Because sometimes when you don't have a word in the language to describe something, this something escapes your reality. Very often, for example, in relationship to, I don't know, emotions, different languages have different words for different emotions that if you don't have this in your language, you don't experience them. Because emotions are largely culturally, it's a cultural construct in a big amount. So, or for example, it's a bit hardcore example, but in North Korean version of Korean, they don't have the word for friendship and love. That means that people inside families and friendship, the relationship there is not the same as in the cultures where these words do exist, so it's easier to manipulate them, the people who don't have these types of bonds. So, okay, so as I mentioned before, we'll start from the top. This fibrous joints in the skull, the amount of motion there is minimal. It's hard to perceive it. People who do this craniosacral therapy, they're able to sense if you are sensible yourself, if you spend some time holding person's skull, you will sense that there is a little bit of expansion going here and there. Okay? Then there is the joint of the jaw, mandibular joint, it's called. Of course, we're not going to go through all this. We're going to go in general big chunks that are important. So, mandibular joint is actually only joint that moves in a different relationship to gravity all the time. Because in order to open it, it's accompanied by gravity. And in order to close it, it has to go against it. In the rest of the joints, it's vice versa. And there are first two denominations that we'll talk about. There is flexion of the joint, which means that I bring two bones together, and then there is extension of the joint, which means that I'm opening the space there. Okay? Then we will move into the next. So the spine, a lot of things are told about the spine already, but nevertheless, it's never too much. So all of the joints that compose the spine, they should have certain degree of movement in them. And together, all these little joints, because I don't know if you can see from here, there are many, they create this complex motion of the spine. create a complex motion of the spine that we experience when we're moving. Okay, and again, as I was talking before, we can go into the very small details of, okay, each of these intervertebral joints is only moving in one plane of motion, and then this another one moves in a different plane of motion, and then together we will go talking about the big picture. So the neck, the whole thing together, has a lot of freedom of movement, degrees of freedom as we denominate it. It can extend, and it can flex. Which plane this movement is happening in? Flexion and extension. Sagittal. Say it out louder. Sagittal plane. Be sure of yourself. It's also fine to be wrong, but at least try. There is rotation around the axis, which is composed of multiple joints moving together. Which plane is that?
Frontal?
No, come on! No, it's not. This one. Say it out loud. Transverse plane. And which would be the movement in the coronal plane, frontal? Lateral flexion. Extension. Flexion. Rotation. And then there is lateral flexion. There is no lateral extension. Nominally that will be extension, but it's not usually talked about these terms. Talked about in these terms. Neck is a very mobile part of the body, so the movements we do, they are a combination of many. Like for example, I can do the flexion and rotation of the neck. Okay, and all of these joints should collaborate. The problem happens when there are certain blockages, so one vertebra will be doing the work for everything else. First, it reduces significantly range of motion, and second, this vertebra will be taxed, and you will have disc problems, etc., etc. So, all the things we did with the spine, those who have been coming before, recommendable to continue. Okay, next, shoulder blades. Shoulder blades are this, or scapula, they're also called. These are the triangle bones, and they connect on the front through what is called an acromion. You see, this is the part of the scapula, this little ridge over here, with the clavicle. Okay? This joint, the clavicular acromial joint, is actually the only thing that connects your arm to the rest of your body. So this is why I said it many times, your arms, they don't start here, even though it's very important to connect the arm that is so mobile and it has so little actual physical connection to the body. Of course, there are all the muscles here that hold it together with the torso. So we need to work on the scapula in order to be able to produce more strength. With this and this little connection, it's not going to work. So the scapula has quite a few possibilities to move. What it needs to do, and we are doing it in the straight arm strength class, it will retract, meaning it slides along the ribs towards the spine. This movement, when it moves together, is also called retraction. And then there is protraction, when the scapula is moving out. So what it does, it's sliding along the ribs outside. Okay, we'll be brainless first. Okay, so that will be retraction, protraction. Then, when you're lifting your arm up, the scapula also moves. It has to. Sometimes it doesn't. And then when people develop all kinds of problems in the shoulder, the scapula moves up. It moves and slightly tilts. And this movement will be called elevation of the scapula. And then there is depression. Depression meaning it gets sad. Depression meaning it goes down. Okay, so there is active, can be active motion. When you're doing the active hang, you're elevating and depressing your shoulder blades. Okay? Then it can abduct, meaning it moves towards the center, which will be retraction, but it's a little slightly different movement in the angle. And abduct. This is a very confusing set of words. People all the time, I don't know why they call it this way. So another denomination, so we talked about the orientation in space, but there's also orientation within this thing in itself. And then there is the center of the thing, and everything that is closer to the center called medial. And everything that is further away from the center called lateral. We're doing these arm movements. One are initiating medially, another initiating laterally. So when you're describing the position of something in the body, it's always relative. Same thing that right and left can only exist because of the body. It's relative to me. Right and left here, right now. When I'm doing this thing, right and left will be somewhere else for me. So in the body, if I want to describe, for example, where the scapula is, I can say that the scapula is lateral to the spine, but I also can say that it's medial to the humerus, the shoulder bone. Okay, so this is the way to describe. There's also posterior and anterior, the back and the front, and inferior and superior. Inferior, down, superior, up. In Spanish, no? Tren superior, tren inferior. Upper body and lower body. Okay, so the shoulder blades we cover. The shoulder has a lot of degrees of freedom. The three, nominally three, but all of this is possible, the combinations of all. This is also, for this reason, the joint that suffers most injuries. So, the movements of the shoulders are abduction, meaning moving laterally away from the center. And then there is abduction, moving towards the center. Okay, when I'm lifting my arm, I'm abducting, and when I'm bringing it down, I'm abducting. To remember this, to add, the difference is just one letter. Abduction, abduction. Okay? Then there is flexion of the shoulder. This will be shoulder flexion. And then there is extension of the shoulder. Going back. Flexion, extension. Also, if you work on handstands, the problem is flexion very often. Extension, you don't need it much for handstand, but you need it for other things. Then there is rotations. There is external rotation, meaning rotating away from the center, and then there is internal rotation, meaning rotating towards the center. It moves around the axis. So see, there is how many possibilities are there in the movement of the arm. Why is that the case, do you think? That nature gave us such gift?
Because we needed to swing on trees.
No. There was a back and forth relationship that created it back with something. Throw? It's in the direction, but think more generally. No. It's within the category, but I want more general term. No.
Walk.
Manipulating objects. Come on, God, people. the arms manipulating objects, and labor, in its turn, it created, like, I mean, over millions of years of evolution, it created something that is so movable. Because what different, you know, one movement that really separates us from the primates. It's movement of the arm. Not even that. Yes, and thumbs, but there is something else. Breathing. This action of pronation and supination. Come on. Pronation and supination. This terminology only refers to the movement of the forearm or the wrist and the foot. It can also pronate and supinate. We'll come to the foot later. Okay, so pronation, this action of opening or closing the door makes the movement of our arms so complex. And of course, the wrist and everything, but the capacity of doing this, it gives us immense freedom, immense degrees of freedom, which are also problematic in the sense of controlling them, but they're also very, very adaptable and they give us a lot of options. So the elbow, flexion, extension, only 1 degree of freedom, because actually this motion doesn't happen in the elbow joint. It happens between ulna and radius here. So this will move, and then also the wrist action, which will be pronation, supination. There will be flexion and extension. There will be adduction and abduction. Actually, abduction, because when we're talking, another thing I didn't mention that is important, usually when the body is described in any text, it is described in what is called anatomical position, which is this one. Okay, so whenever you think about this terminology that we're talking about, this is the position that they will describe. Okay, so abduction. Okay, fingers also flexion, extension of the fingers. A lot of look how many joints are there. That's why it makes it so movable. If you have ever shaken the hand of someone with cerebral paralysis, ever, they have blocked the movement of the joints, and the sensation of their arms is very weird. It's until you actually experience this, like the difference, the inability to move all these joints, you don't appreciate what you have. And then I was like fascinated, like, oh wow, it was really crazy. There are so many combinations. I mean, human body, amazing stuff. Okay, good. Let's move on. Okay, the spine. As a global thing, the spine, also the thoracic region, which is the most rigid for people, because there are ribs attached to it, and also because it is something that is not moved as often. The neck and the lower back, even people who are sitting all day in the chair, they're moving it somewhat, because we need to look and we need to walk. Okay, even this kind of people, certain amount of movement in the lower back is happening, but the thoracic is very often neglected. However, it can also, again, as a general whole thing, it can extend, it can flex, it can rotate. Very little rotation, but nevertheless there is. It can lateral flex to one side, lateral flex to another side, and then all kind of movements that combine it. Okay? Lower back, the same thing. Extension, flexion, rotation, lateral flexion, and the spine, taking care of it is one of the most important things that you can do for yourself, also because of the function that it has in the body, which is, guesses? No.
To hold your holding.
No.
Your nervous system.
It's one function, but it's not, not in terms of movement. I'm asking in terms of movement, what it does as part of the body, of the bigger system.
Connects the
It organizes the rest. The spine organizes the rest of the body. That's the center of you. If you don't know how to organize this, you can do whatever until tomorrow, you know how to do. And it's not going to be efficient, it's not going to be really functional. Unlike the sport, that your body will not function well if this is not taken care of. And this, I mean, it's an incredibly complex system. It's like the magic of, I don't know, the architecture of it is incredible. And of course, it has the central nervous system. If there is a serious damage to the spine, it's done. You can cut your arms, you can cut your legs, the person will still live. The spine, better take care of it. But it's not what we're talking about currently. In general movements, flexion, extension. There are also gliding movements of the spine that can happen when the vertebrae are moving in this direction. So there's also a certain amount of movement that is gliding in the spine, not only the flexion, extension, etc. Okay, the pelvis, which is also a pretty sophisticated structure because it connects the lower body with the upper body. This is the place where the forces of gravity of all the impact are transmitted up. Hip joint, very similar to this one, ball and socket, very open, a lot of degrees of freedom. Not for all people, because there are a lot of genetical makeup has to do with how flexible your hips are, because some people, it's just, you can, until tomorrow you can make them do splits, it will just never happen, because there is a certain structure of the ball that doesn't allow it to happen, and pushing too much can be a problem sometimes. But nevertheless, degrees of freedom, it has internal rotation, external rotation, internal towards the center, medially, like boom, external, outside. Here, the same, internal, external. There's flexion of the hip, and then there is extension of the hip, the diagonal stretch. Okay, the key to all the acrobatic movements is an extension of the hip. Also walking, running, etc. Because it's a very limited range of motion, so opening it actually creates better passage for all these forces that are impact force and also connecting to the floor to produce force yourself. Flexion, extension, abduction, abduction as well. Abduction, abduction. Okay, and then there are combinations. For example, which movement is this? What I'm doing with my right hand now. Internal rotation and abduction. Exactly. And now I'm externally rotating and abducting the hip. Okay, or I externally rotate the hip and flex it. So all these combinations are possible to describe. The pelvis, this connection to the sacrum, it also has to have certain degree of movement. But also too much movement here can be also problematic. I solved it, thankfully. I had the problem with very lax sacrum and it was a mess all the time. Injuries happening, whatever I did. But still, if this is completely rigid also, it also creates a lot of issues because the forces are just not transmitted, they're getting stuck, and then people starting to get lower back pains or it goes somewhere else, but it's not optimal. Always you want to find the amount of movement there that is not too much, like the contortionist, but also not the body movement. So there is certain risk of working on extreme ranges, even though you do want to develop a certain amount of flexibility, of course. Mobility, rather, the better way of putting it. What's the difference? Anyone tell me between flexibility and mobility?
Flexibility is what you're naturally able, and mobility is what you can.
No.
Mobility is active,
It's like strength.
flexibility is passive.
Correct, thank you, sir. Mobility active, being able to produce strength in the range, in the end range. Flexibility is passive. Just getting into the pose. In yoga, for example, you go with gravity and you can stay. But then it doesn't mean that you can use it when you're moving on your feet. Okay, so also important thing to remember. And in joints, what you want to work on is mobility. Because too much of flexibility in the joints is not working well for the system. It breaks something in the ability of the body to move. And it happens a lot with people like contortionists. I worked with a few people who did this. Also people who do a lot of yoga, there is a problem that develops over time. Because it's all the time passive, and people cannot use it when they're moving. So whenever a little bit of strain, a little bit of demand go there, there is an injury immediately that happens. The knee, flexion, extension, and reset, it's a hinge joint, 1 degree of freedom. There is this little bone here called patella, which is the top of the knee, the kneecap we call it. So it works like a pulley. So the way that the muscles are arranged there, so there has to be also some freedom of movement. So all these positions, when you put a lot of stress on the patella and you're allowing it to kind of grease this section, it's very helpful for basic things like walking, running, everything that has to do with moving on the legs, which is the primary function of the lower limbs, like a motion, moving in space. Okay, so the knee, this joint here also should have certain amount of rotation. We did with some of you, if you were coming, we did like the tibia rotations, tibia and fibula, the bones fall when we're moving them in and out. So that's what I was saying. Okay, the knee joint is a hinge joint. It has 1 degree of freedom, but if there is no rotation of the sort, then it's also problematic. The injuries that they get, for example, in football a lot, the meniscus tear or the ACL tear, which is much more complicated to solve. It happens because, the joint moves here, so it's protected in this range, but as soon as they change direction quickly, and there is a little bit of rotation and twist, it's done immediately. And so usually very severe injuries because it's acute. It happens at the moment because there's so much load that the joint just cannot withstand it. The ankle is also very complicated, just as the hand. There is a researcher who wrote a whole book just about the ankle. James Earls, I think his name is. So he considers the foot an organ. I cannot say that I agree with this 100%, but he said something as that, like, podologists need to study the foot just like doctors work with vision need to study the eye, the complexity of it. And it has some truth to it, because look at this mechanism. It's I could give you, half a year course on just the way our feet interact with the ground, and how it moves with the force, and how all these things developed, anthropologically, and etc., etc. But what we're going to be talking about today is, there is a plantar flexion, which is the bunny foot. This will be the plantar flexion. And then there is a dorsiflexion. Okay, there is no extension in the foot. There will be flexions. Dorsiflexion is this. Plantar flexion is this. Okay. Then there is pronation and supination, and the set is the foot. And then there is also abduction and abduction. Very little range, but it's still there. It can move in this way. It's really hard to actively separate. You see, it's possible. I can move the foot, but the tibia is not rotating. So this gives me more options when I'm using my feet, basically. And the problem with the knees, often people have either excessive pronation, excessive supination. When either their knees are collapsing in or their knees are falling out. Neither of them is optimal because, again, the transmission of force happens very unilaterally, and then either internal ligament suffers or external ligament suffers, or meniscus on internal or external. Okay, and then movement of the toes is also flexion, extension also, and some abduction and adduction also. As here as well. You can abduct and abduct. But it's not often talked about. Okay, so we covered the general things. There is also, I will mention the tilts. The tilt is getting off the horizontal line, and it will be the pelvic tilt that can happen laterally when the whole pelvis is moving to the side. And then there is important ones, posterior tilt. Remember, the posterior side is meaning that the pelvis is tilting posteriorly. And then there is anterior tilt, tilting to the front. Okay, this is important because you need it a lot. When you need to work on the flexibility on the hamstring, you need to really make sure that there is an anterior tilt. In squat, you want to really make sure there is an anterior tilt. When you're working on the handstand, you want to really make sure that there is a posterior tilt there. And this is two positions that you want to dominate and you want to differentiate them well. For example, in the Nordic curl that we're doing in the leg day, the problem for many people is that there is no precise differentiation in the body between movement of the lower back and movement of the pelvis. So this movement and this movement are two different movements. Even though from the side, someone who doesn't have an eye will think that it's exactly the same. So for many of you, what you're doing, you're just moving your lower back in and out, instead of moving your pelvis, and my spine stays neutral. So I'm only changing the pelvic position, and then everything that is attached to the pelvis moves together with it. So this differentiation of different movement, decoupling also, retraction and extension of the spine usually come together. But in order to really differentiate, why can I not extend the spine and protract the shoulder blades? It's also a possibility. No? Probably not many places you will use it, but it's good to be able to decouple those things and understand also that I don't have to always extend my spine when I'm bringing my shoulder blades together, because it takes something away when I'm trying to precisely go into this area and address it. And these little differentiations and recognitions are important to observe and analyze, and to see, okay, when we're working on the rolls in the class, and we're working on the head movement, and I tell you, no rotation, and I see you doing this. It's not because you're a bad person, because you maybe did it, maybe, I don't know. But it's just the lack of orientation within ourselves is what always very staggering to me. And I'm not saying it from the place of like being high on the mountain. I've been there also. I know how it feels. Sometimes it's easy to forget because my experience of life and of my body and of my movement is very different than it was 5, 10, 15 years ago. But the result I have is because I deliberately work on that. I deliberately want these things to be very clear and very precise, because this is the self-study. It's not only the workings of, people go to psychotherapists and they are trying to figure out. Also, I doubt that some psychotherapy methodologies are very efficient, but it's a way. On the other hand, for whatever reason, people don't treat their body in the same way nowadays. So, the one thing is you need to do, another thing is kind of neglected. You need both. You need to treat everything with the same interest, with the same curiosity, guess it's the same thing, but being really, involved in asking the questions and differentiating these things. So hopefully that will help a little. And again, if you want to learn a little bit more in detail, you have these things over there, millions of videos, anatomy atlas, in any bookshop, anything. Whether it's necessary or not, it's up to you to decide. Just studying all these names and nerding them out is a bit of waste of time. I did it. I could have spent my time much better. It's better to learn about more general things, general concepts, and different models of how we can treat the body and think about it. Which is, okay, last thing I will talk about today is this model of the body. This is the model of the body, which is called a tensegrity, which is a combination of tension and tension. So, have you seen it? I mean, some of you seen it because I brought it already to the class. But those of you who didn't, what calls your attention first in this thing?
White structure.
Structure. The structure, the feature of it. What feature of it calls your attention?
The shape. There's like hard parts and soft parts.
Hard parts and soft parts. Yes, it's a range. There are tension and compression components, both creating a unified structure. Anything else?
That the white parts are sustained by the
That's the same as the brain. It's hard and soft. Black and white, it could be red. It's not.
So there's a relation.
Yes, there's tension and compression. And the soft elements, they create the tension element, and the hard element, they create the compression element.
How the hard parts not touching together?
Yes, that's a good one. The hard parts are not touching. That's a very important part of it. That they are creating the space, and it's taking a lot of space actually, but it's very light. I will give it, you will be able to touch it. And this is by far, if we're talking about the way that our body is constructed, it's the best model that exists. The mechanical model, again, as I said at the beginning, is not so good because it supposes that the body is a machine, which is not the case. And I think it's great that it existed. It started with a man called Borelli who wrote about the locomotion of animals, and he was writing about machines at this time because people were fascinated. It was like at the beginning of the Industrial Revolution, and everyone was fascinated with machines. A little bit the same thing happened with psychology and computers in the 50s. Because people were fascinated with computers, and then all psychologists who were working at this time started to compare the mind to a computer, which is also a huge mistake. There's nothing, there might be some similarities in the way it functions, but it's very, very different thing. But we need certain models to think about, and this offers us a better view in what the body is. This thing is connected. And the fact that it's connected is what gives it its properties. If I would deassemble it and I will put these wires and these hard parts on the floor, it will not be the same. So the whole is not the sum of its parts. 1 plus 1 doesn't equal 2. It equals 20. It's the same as I was talking about the degrees of freedom. 1 degree of freedom plus 1 degree of freedom doesn't create 2 degrees of freedom. It creates huge combination of. That's why in robotics, for example, it's 2 degrees of freedom is like already wow. It's a very hard machine to control. And this, it can withstand a lot of stress. Look. Nothing happens to it. It's really hard to break it. And the body has similar properties. Of course, again, there is no model that is good enough as the thing itself. But in order to describe it, to understand it better, having something like this in hands gives you a lot of ideas. Of like, okay, maybe I have thought about the way I move and the way my body assembled in a certain way, but now as you touch this and you actually experience like, oh wow, interesting. Something will click. Because also, in order to have this, it's, you know, it's like 6 struts and 6 struts and I don't know how many, very few ropes. Human body is infinitely more complex than this. And it consists of several consecutives. So, the connectivity in the body is often disturbed, yes. And that's why it loses its properties. Because if I do this for the integrity, suddenly, it's not gonna behave the same way anymore as it used to when nothing was holding it back. And it was all connected, and it was all assembled as it was mentioned. And there is another important difference between this system and the human body. Who can tell me?
Mind.
No.
Linearity.
Linearity. Of course, all these things are true, but there is something much more fundamental.
This doesn't change its structure.
This is assembled. It's made by someone, and in fact, the tension that was put into it by the person who did it is the tension that stays. Like this last is the one that put the whole thing together. We did it ourselves with Dani, and until you put the last thing, nothing, like it looks like nothing, and then you like connect the last dot and magically it happens. You go, whoa. So, and the human body is the self-organizing system. From the single cell to 2 cells, into clump of cells, into the organs, into the systems, into the whole thing, and it continuously develops. If you look at there were very interesting, I was looking at the embryos radiology images, and you see how the fiber of the muscles are being directed in the direction in which the bones are growing. So as the body is expanding, it creates this tension from within. And this is the difference. Okay? All this bit.
It creates what tension?
Hmm?
You say it creates the tension.
The tension, the growing of the body, the growing of the bones and the muscles attached to them, it creates this tension, this integral unity of the body. Someone was there and someone put it in. There is the systems that are assembled and systems that are self-organizing. Like a tree, there is a seed and the seed has infinite potential inside, and then it organizes itself, which is also an integrity. In fact, this model is representation of the structure of everything, because an atom also has the same structure. If you, under the microscope, you look into the cells, what do you think you find there the most? The same as in this structure, you find an empty space. You know what is infinite gap? What they call in the physics? You never touch anything. If you're like zooming in, there is always a gap. between things. Everything, all the cells, all the assemblies of the cells, there is much more empty space than the matter. And this is true for everything in the universe. Go figure. Okay, good. So just a little bit, it's very general. This is something that you can study human body forever, never, never. You will not finish your studies till the day you die. But it's good to start somewhere. So, if you have any questions, we can go through it. Any specifics? Anything general?
Yeah, question.
Yes.
Regarding the rib cage.
Yes.
Why is it the front part they're transparent and can you say
Because
something
it's
about
cartilage here.
Ah,
They're connected by the cartilage.
to the sternum?
Yes. The sternum. Then there's the cartilage, and then there are floating ribs, which are this. It also has to have certain amount of movement, and the ribs themselves, when you're breathing, the rib cage, I didn't mention that, but there should be an expansion. And for many people, the problem is that it's non-existent. So the pattern that often happens to people, also because of the weak diaphragm, is this. You see, I'm exaggerating, but there is this movement, and it causes the posture when the ribs are sticking out in people. That's a very common thing. You see people and their ribs are sticking out. It's not a good posture, because the diaphragm and the pelvic floor, they should be parallel to each other. And also the mandibula, but it's usually not that distorted. So whenever there is a change in either of them, another will always fit. And the breath is, how many times you breathe per day? All the time. So it is something that has a lot of potential if you pay attention to it, to actually change your structure, because most of the time when you're not paying attention to it, it's reinforcing this pattern. You would have to, develop practices around actually seeing and making sure that, it is there. We did it in the class, old school, we were there, we did a little bit of like breathing, and we were breathing into different parts of the rib cage. You were there, no? How? Like breathing into it, just developing the understanding of where it is going. But, the cartilage. Anything else? No? I think. Yes, go ahead.
Question about the feet.
Yes.
It's so barefoot running on hard surfaces and stuff like this. Do you have a opinion? Because there's like yes, it's good, no.
It depends. It depends. My opinion is that most people shouldn't run in the first place the way they do. Sometimes you see at the beach people running and you're like, oh my god. Like they're hurting themselves. It feels good because people use it to clear the mind or whatever. That's a different topic, but if your feet are working well, if your structure is well connected, if your feet can absorb force, there's no reason why not. But if there is an issue, if you are not interacting with the gravity in a way that is not detrimental to the body, then it will hurt you. Especially running on a hard surface, and especially running barefoot. Running in the padded shoes, also a big problem, because the shoes are doing the work for the foot that the foot is supposed to be doing. But for some people who had problems with knees, for example, I have a friend who had an ACL reconstruction surgery. It's really hard for him to walk in barefoot shoes, so he has to wear padded shoes all the time. But he's working towards reducing. So it depends on the situation. I will always, if you want to do it, if someone wants to run barefoot, first of all, it will be better to run on an uneven surface. That will be the best thing you can do. If you want to run on concrete, first take care of the structure, of making sure that you know how to absorb the shock of landing. you know that when you are making contact, the body is aligned well, work with the technique, which is, I'm not a big fan of techniques. Work on figuring out how to better align your body. And then you can do this. And like start, like everything starting a little bit, you know, not going to the place where, okay, maybe I'm not doing it right, so I'm really fucking myself up, but exposing yourself very gradually to the thing. But it's all, everything is context dependent. There is nothing that I can tell you that's like, this is this way, this is that way. And I would like people to develop this thinking also in relation to the practice, in relation to the body, because I engage a lot with ideas and things that are relating to this and to other things. And the ideas where I find the most substance are the ideas that are paradoxical, that are true things that are opposite at the same time. These are the best ideas to engage with, because they have something. Nothing is ever, you know, one-sided. There's always something, rather than a spectrum, it will be. So, and that's good. And I think in life in general, it's true for everything. So, but you need to be engaged also. There's also like the danger of falling into relativism. You know, when it's like, now everything is equally good. No, it has to be very contextual dependent, context dependent, and like each situation has to be analyzed and experienced also, because only ruminating and thinking is not a full picture also for anything. Anything else?
You spoke about contortionists,
Yeah.
right? Do you think that over time, like as the body continues to develop, like that is actually, it's less beneficial for them, and it starts, like they could get,
Contortion, of course.
yeah, bad for their bodies, like.
Anything that is hyper specialized, anything that is hyper specialized is detrimental to the body. It doesn't mean you don't have to do it, but if the choice is informed and you know that you'll pay the price, it's fine, engage with it. But any hyper specialization will make you pay the price. And with things like contortion, it's very extreme. It's a very extreme body practice. And I know contortionists, they are not pain-free, let's say so, and they have a lot of problems in the body. Many of them, that's what they do for living, so they continue doing this. That's their craft, that's something that they like to do, so they're willing to pay the price. But when you engage with something, the question should be like, am I willing to pay it? And you can study something to a certain degree, but then there is a moment like, okay, if I want to really go deeper into this, there will be something that I will have to give in exchange to have this. That's why the idea of the movement practice is not mediocrity as many people think. Like, I just do a little bit of everything and I'm just mediocre. No, we study things really in depth. There's things that I'm working for years, every day, studying it. I'm really going for, like I used to go for hardcore skills, you know, and it has its place. But there is a moment where, like, okay, like with hand balancing, for example, there was a moment that, okay, I'm going to stop here. Because if I want to develop further my hand balancing, all my time has to be devoted to this. And I want to do other things. Do I have a good handstand that I can use whenever I want? Yes. I have very good control over my handstand. Little shapes, I can invert, whatever. This is there. But if I would go further, I would work to like one-arm handstand and all the variations of one-arm handstand, I will be a hand balancer. I won't be doing what I'm doing now. And the same if I would want to develop extreme ranges. I'm pretty flexible naturally, which is also a problem, but like there was a moment, okay, I was working on the wide splits, okay, I got the wide split, I fucked up my hip. It wasn't worth it really. Now in the retrospect, you think like, what is it good for? A picture for Instagram. And that's what it was good for me, like it didn't, I don't use it ever. But I wouldn't learn it if I wouldn't do it. You know, now having this experience, maybe certain places I would, okay. But it doesn't mean that you shouldn't go meditate in torsion class and stay for a while studying it. But there has to be understanding that the hyper specialization will always make you pay the price.
You said that you, as far as like it's naturally you're really flexible. So what about like for people who are not, like I guess should there be a certain balance of where
Of course.
should be like everyone should, or like genetically if you want
You should work on your mobility. If it's your mobility, not flexibility. As we were talking before, not the passive stretching, Which this is not like people do this. It's not that it's like bad, never do this. It's not going to develop what you think it is. And if you do practices like contortion or you do a lot of yoga, like very steady positions, there can be developed a problem. Doesn't mean it's bad. It's very relaxing. For example, like these passive stretches before going to bed, if you have trouble sleeping, it's really helpful. It calms down the nervous system. But if you want to develop ranges of motion, you need to work on mobility, which is working with loaded stretches, progressive overload, just like the strength work. So you're increasing the weight if you're working with weight, or you are increasing the ranges very gently, working against the gravity, not together with the gravity, etc. There are many methodologies. We don't do much mobility now in the class, some things here and there. But if it's your issue, address it, of course. It's good to have it, because people who are rigid has its advantages, has its disadvantages. Same thing with people who are very flexible, has its advantages, has its disadvantages. So, like for me, it is really hard to connect the body, for example. Like some acrobatics elements for me are incredibly hard because I just fall into the bridge and nothing happens there. When my husband, who is stick man, he does everything super easy because he was very rigid. He developed certain amount of mobility, and he compensates this lack of ranges of motion by producing a lot of strength, and a lot of not strength like explosive power. So he can do these things much better than I am, and it took me much longer to learn them because of I'm flexible. But then there are certain things that he cannot do because he's just so rigid, So there's always, and it's when someone comes to me who's a contortionist, I'm not going to make them develop more mobility there. It's like, okay, you're doing strength. Someone who comes to me who's a bodybuilder, this person is not doing any strength exercise for the next 5 years, So it also depends on each person and how they work on that. But finding, researching it, finding ways to do it, sticking to something, that's the way. Okay, anything else?
How the pronation of the foot affect the pelvic?
A lot.
A lot.
A lot. The feet and the hips are pronated a lot. And most problems, for example, I don't know what happens to this desk. A lot of knee problems, for example, they don't come from the knee. It's either the person has problem with the hip or the person has problem with the foot. It's either of those. But the feet, it affects a lot because there should be certain. There's something that's called a plumb line. They use it like in physiotherapy just to see how the alignment of the body and the gravity works, and the deviation from this line in any either in frontal or in sagittal plane. It means that the alignment is not perfect. Now, I ever doing this in life a lot? No. So the posture is dynamic. That's an important thing to understand. Working on, I do this, to say something about this, I do this and it's a very beneficial practice, to just standing. Because it informs the body. Because all our movement is done in relationship to gravity. This is like the most fundamental thing to understand, and this is something that, for example, when people do handstands, or now you're moving on the floor, it is so confusing because your references are different. You are used to be this way, and now you're this way, you know, and the gravity pull is from a different angle. When your foot is deviated, then the rest of the structure, because of this principle of connectedness, if I do this even on this model, okay, I do this, look what happens to the rest. Okay, this goes here, this goes there, it pushes the hip to the side, the hip is tilting. There is a lot of connection, everything. Look, the body is a unity, and there is nothing that can be isolated in the body. So often, there was this woman called Ida Rolf, who created the body work therapy called Rolfing. I haven't found a good practitioner here in Barcelona. There are some, I haven't gone to them. I did it with someone from the US. But maybe you want to try. It's pretty expensive, it's like 10 sessions, but they work with like alignment of the fascia and with bringing back this like integrity system, rearranging the collagen and the body, etc. But what she said, and she understood, it was like in the beginning of 20th century, that when someone comes to a therapist and with like shoulder pain, very likely that the shoulder is not the problem, it's just a symptom. So the same thing, of course, like you maybe have a pain in the hip, it means that probably something is not right with the foot, maybe also something up there, but usually it will be down the line, closer to the source of pull of gravity. How? Again, it's a question to investigate. Working, like doing the standing practice is very good because it develops this understanding of, okay, how my body is aligned in this position. And then it informs your movement also. But you have to be willing to do it every day. You know, like for 30 minutes in the morning just to stand. Like standing meditation, you can call it, but just a practice of observing the body.
Observe.
Yes. Just figuring out what is there. And then when you're moving, when you're walking, trying to investigate and what is going on there. Why do I have this problem? Why do I have this pain? Maybe it's the foot, maybe it's something else, but you can go to therapists, you can go to people to give opinions about, okay, I have had, I don't know, 10 different diagnoses on my injuries from different people. Like, no, the problem is this, the problem is that. Some of them helped me, some of them didn't. But eventually, the person who was able to resolve this was myself. Because, okay, with all this knowledge of the body, I have this issue, it's kind of a, how do you say it in English? I don't know if there's a phrase. Like, in casa de herrero, cuchillo de palo. In Russia, we say the shoemaker without the shoes, you know?
Yeah.
And it's like I was having all these injuries, and I always investigate what's happening. I might go to someone, okay, to maybe correct something that they don't reach, you know? But at the end of the day, what needs to be done is you investigate and what the issue is. But yes, it's all connected.
But is it like pronation affect in a certain way, like the frontal tilt? Or
Yes.
I don't know, because I don't know if it's a certain rule that
Pronation,
the pronation is affecting some way and
the run, supination.
is like when you go with
Yes.
your knees inside.
Yes,
and
the pronation,
I
I
don't
mean,
know what's happening with the hip, if it's going forward or going back.
it can, when it's pronated, it goes in anterior tilt, supinated posterior tilt. But it's not a rule. It can be different.
Can be
There is like, okay, people would usually say like there is this connection, But there can be other factors that influence that. And then maybe there is no tilt, maybe there is lateral tilt, you know, not
Or everything goes to the knee.
exactly. It
Yeah,
can go
everything.
very often it goes to the knee. Like I was having some knee trouble and it's not like I know that knee is fine. Like I need to do something with the hip. But this is the self-study that you can go and read the books and see, okay, the pronation of the foot causes this, the supination of the foot causes that. Then you stand in front of the mirror and you see, okay, is it or is it not? And then eventually it doesn't have all this terminology, it is all great, it is good, but as I said at the beginning, there is nothing more precise than direct experience of you. You might not even know the name of the thing, but when you experience it, when you perceive what's happening in your body, you can address it. And you don't have to describe it in words, because the words are corrupted, they're not good medium to describing things. We don't have a better one, so we have to, but the direct experience of the thing will give you much more information. And then you can try to find like the names, there's like valgus, it's called, what this goes in, but what does it matter? You can talk to someone of medical professional with a physio and tell them, no, I have the valgus and my hip is, but it's a little bit empty to me. Because it's more, Ido said something once, he said many things that have changed my life, but there is like one of his phrases that stick to me. He said, don't tell me how my body is connected, I decide how to connect my body. And this is it's something worth reflecting on. Because there are many things. There are people who have full rotator cuff tears, like I have this friend in Dubai who has full ACL tear. He's doing all these crazy flips and acrobatics, it's not. Anyone would tell him that his body is connected in the wrong way. You don't have an ACL. You cannot do these things. Or they said to my husband, who had like some shoulder issue, has an arthritis, because it was dislocated 20 years ago. And the doctor looked at the image and said, oh, but it's a shoulder of 80-year-old. And he's doing like handstand push-ups and stuff in the rings and don't know. He told them, and if Danny would be susceptible to someone else's opinion, he'd probably say, oh my God, I have a bad shoulder, I'm just going to stop doing this, But he did it. Or my friend Vlad, who used to come here, who broke his both legs. He fell from the cliff, he broke his both legs, and the doctors told him, I'm not going to be able to walk again. After he's out of the surgery, on the phone, I'm like, Vlad, this is all bullshit. Don't listen to them, we're starting to rehabilitation now, at this very moment. He's walking now, he's walking yesterday, So these are the things. It's good to know those things, but as I said at the very beginning, this notion, okay, my body is a mechanical thing, it can disrupt something. So having these different maps, having these different models of describing, reality is really good, but actually the more of them you have, the more you understand that none of them is a good one. None of them is precise. The only precise one is the experience that is direct of the thing, that is non-verbal. So this is what I encourage people to be busy with all the time.
Are there techniques to have experiences on the soft parts of the body, not the, I know that we talked about the muscle system now, but for example, the organs, apart from the heart, for example, is an experience. But are there?
Yeah, of course, you're doing it. The practices of just scanning of certain body, the Feldenkrais, Sandor technique, all these different methodologies that people develop because they understood that paying attention to the body is important and you can do a lot of things with it. It's misunderstood a lot. But there are many. Just standing, what I was saying, guys, just standing and observing your body is already a practice of this sort. Shaking, there's this video of 25-minute shake. Try to do it for a month. You will be surprised. And you can perceive, because I know it, because I've been doing it for a very long time, people think that they cannot sense the bones, for example. It is not true, I've sensed the bones. No, I've sensed the movement of the fascia inside of me. I sense my organs sometimes. Like it's possible. But the first thing to do is to reduce tension, because tension is killing your receptive quality. And the second thing is to be engaged with practices that require your attention and paying attention to the body, and then you can penetrate these layers and you can develop a very high level of sensitivity. Anything else?
Very good, but we will wait.
Okay, no questions anymore? Okay guys, thank you for coming.